In Sanfilippo syndrome, we use the Bailey scales of infant intelligence. Okay, that's or infant development rather, and the Bailey scales are used all over the world. Many of the trials for these diseases are international trials, and so they have to have measures that are familiar to psychologists or assessors who are in many different countries in the world, because in order to get enough subjects to really understand both the natural history and the response to treatment, you need to do international trials. And the Bailey is a very good example of a test that's really sensitive. We recently published an article about the natural history of Sanfilippo syndrome using the Bailey, and was able to demonstrate the rate of decline that could be compared then to a treatment trial in that disease. Yeah, and we're always looking for tests that cross borders. The Kaufman Assessment Battery for Children is a well-known test used in many countries around the world because it's highly nonverbal and it's pretty culture fair. And so we use there's a nonverbal scale, and we use that in other countries to measure cognitive outcomes. And so that's a good example. In fact, I've been involved recently in looking at cerebral malaria in Uganda using that particular test, using the Kaufman Assessment Battery for Children. So I'm not doing it, I'm just consulting with people who are doing it.